A 25-year-old is brought to the emergency department due to fever, agitation, and disorientation. He has been seeing and hearing things that do not exist. He also drools excessively and has several painful throat spasms when he attempts to eat or drink. The patient returned from a camping trip 5 weeks ago. Physical exam shows mydriasis and neck rigidity. Which of the following acts as an entry receptor for the causative agent of this patient's condition? This patient is presenting with signs of a rabies infection. Now, rabies is going to be a RNA virus, and once it affects patients, it is going to first present with fever and malaise. And as the virus makes its way to the central nervous system, we're also going to have rabies encephalitis, where we're going to see autonomic dysfunction. So, signs can include excessive drooling, pharyngeal spasms, and as a result of these pharyngeal spasms, the patients are going to have a fear of eating and drinking. Now, what is important to know about a rabies infection is that the virus is going to make its way to the central nervous system by first binding to the acetylcholine receptor. So here we see the envelope for the rabies virus. It is going to be a bullet shaped envelope that has glycoproteins on top, and these glycoproteins are going to attach to the acetylcholine receptor found on the peripheral axon. And once it does that, by using dynein motors, it can transport its way to the central nervous system. And this is called a retrograde transport. Now, we're also going to see Negri bodies, which are going to be eosinophilic inclusions most commonly seen in the hippocampus and the cerebellum. So here we see eosinophilic infiltrations called Negri bodies. To answer the question, the answer choice is going to be answer choice B, muscle acetylcholine receptors. Answer choice A, B lymphocyte CD21. This is going to be the cellular receptor for Epstein-Barr virus. Answer choice C, nasopharyngeal intracellular adhesion molecule 1. This is going to be the cellular receptor for rhinovirus. Answer choice D, respiratory epithelial sialic acids. This is going to be the cellular receptor for the influenza virus. And answer choice E, vascular endothelial integrins. This is going to be the cellular receptor for cytomegalovirus.